Started this evening. We'll go ahead with the good news with Mr. Sadoff.
Okay, just a few things. One that's not listed yet that's been, I know everybody's been wondering about, that's always a little bit of a moving target, is that at this point it looks like we'll be up approximately 28 students on the certified count. That was a number, it's been getting better and better. There were a few schools that had not entered their data yet, and then as they add in, that number has improved for us. So when we started thinking we were close, when we had submitted without errors, the end of last week, we were down about 33, but then as some other schools have added in, that number is approximately plus 28 right now. So that's a good thing. I mean, that's important.
And that's net of like people that opted to actual homeschool?
That's
Yeah.
from last year's number.
Right.
And I would say one thing that was significant, you know, we had historically large preschool last year, and each preschool student is 0.5 in certified count. We were around 160 or so, and we're significantly lower this year in preschool, maybe around the 120. So if it weren't for that kind of thing, that number would have been even better. So I do know that this is a year that across the state there are districts expecting enrollment may decline. You know, parents have the choice whether or not to send a kid to preschool, whether or not to start a kindergarten student. I believe I heard one of our neighboring districts say that they expect to be down about 50 in kindergarten. So, you know, I feel like we really have done well considering. So that's added good news for you. And then there are a few other things there. There was a picture of Edie Conrad, who works in our health office at the high school. She created and donated this t-shirt quilt. It's been a nice addition there. I've had it on Facebook before, but there's a picture of some breakfast kiosks. We have a couple at the high school in high traffic areas. And I would say the food service department has been very creative, very good about trying to get food to people, try new things. I don't have recent numbers for you, but I know that participation in the meal program has been going up as this year's progressed. There's a picture there of our life skills class with one of the interactive flat panels, another story that I shared. We're hearing really good things across the district about that as a learning tool. And our teachers have been great about you know, learning how to use them, and we provided some professional development there. There was a story in there about the Pride of Indianola, and they were featured on KNIA radio. That was from when they were at Pella, and I know they were at Valley Fest just this past weekend too. They're getting toward wrapping up the marching season. Very high participation in marching band, and that's been a real positive this fall, along with the extras that are part of that are kind of neat. Drumline and the flag corps are really neat. State golf happened at the end of last week here. We had several individual participants in that. Our team just missed, but we had 3 individuals participating in state golf. And I believe I heard that was the most of any school in the state that didn't qualify as a team, so that was great. And then I just put a couple of notes in there for you too, just to give you a little flavor of how virtual parent-teacher conferences were experienced. Those are just a few comments I saw out there that were unsolicited praise for how things went, and seemed to go very well. So that's what I have in for good news this time.
Any other reports from the board or anything? All right. We'll move on to the consent agenda.
Is it, do we have the speaker come before this?
Oh, we do have delegations. We do have somebody signed up to speak tonight.
Oh, do we?
Yeah.
Okay, sorry. Okay, yep, thanks, Ken.
You can stand in the.
Hello, everybody. Do you guys mind if I remove this so I can read? Okay. My glasses fog up. So, for those of you who don't know me, most of you know who I am. My name is Danielle Burrows. I am currently the PTO president at Irving. I've been on the board for over 3 years now. This is my daughter, Reagan. She is in the 5th grade at Irving. And we also have a kindergartner, Cooper, who is 5 years old, who is enjoying his first year at Irving. So, Today, we're here to talk about what's on the agenda tonight about you guys voting on masks at the elementary level. This is something, I have some literature here from several parents that have gotten together and written this and discussed some questions or some concerns that we have about requiring them at this age. So I'm going to go ahead and read this. These are the concerns we have is who is going to decide whether or not the students wear the masks properly? We all know what's the proper way to wear a mask, over the nose, over the chin, you know, touching it, not touching it, all that stuff. Who's going to be responsible for making sure that these students at these ages are doing that? If it is determined that the masks were not worn properly, will the students still be required to quarantine? To some, this would seem like an unnecessary battle for the result to prove the same. Meaning, if kids aren't wearing the mask properly, say somebody's not putting it over their nose and then they become, have COVID-19, the whole class is gonna have to quarantine anyways because it wasn't. Is this battle of making all of these students wear masks worth it when we all know a 5-year-old is probably not gonna wear that mask properly? No matter how many times I tell my 5-year-old to keep his mask on when we're in a store when it's required, you know, he still pulls it over the nose or plays with it or fiddles with it. So that's the thing too is, are those students gonna have to quarantine anyways? In the new plan, it does say you will allow students to attain a waiver. Could that then result in the entire classroom shutting down if that one student tests positive? Or will it be mandatory for the student to be at a 6-foot difference from peers? Is that considered good for a child's health? So basically this is just asking, say, where's a waiver in a classroom? Is that student going to be secluded to a corner that is 6 feet away from other classmates? Or just simply if there's a case in that class, everybody's going to have to go home? Again, saying, what's the point of having this big battle of masks if they're going to have to quarantine anyways? Please understand that while as parents completely understand the idea behind the use of masks to try and lower the number of students needing to quarantine, we're just concerned it is not something that will be able to be properly implemented. So Reagan here has some cards. This is from Johns Hopkins Medicine, published an article about what is the proper way to wear a mask. So the first thing is to wash your hands before you place the mask on. You can turn to the next one, honey. They'll hear me. It's all right. And then the next one is to only handle the mask by the earpiece, not touching the cloth part at all. Go ahead. And then to make sure the mask fits over the nose and over the chin. Go ahead. And then it says make sure you can breathe and talk comfortably through a mask. Go ahead. Don't remove the mask while around others in public. Don't touch your or your child's mask while it is being worn. Don't leave your nose or mouth uncovered. Don't wear the mask under your chin with your nose and your mouth exposed. Don't share your mask. Wash your reusable masks after each use, so daily. Wash your hands before and after touching the masks. This is the big thing for us as parents is you have the lower level students who are going to touch their masks. Are they going to spend the entire day having a teacher telling them, please go wash your hands, please don't touch your masks? And we are already cut short in the school day because we're getting out at 1:30. And now you're going to expect these teachers to pay attention to the students touching their mask. Did they wear it properly when they were around this person who maybe had COVID? We feel like we are already missing so much. And this is only going to make it worse, especially for those lower levels. 5th graders, yeah, they might be able to do it. Kindergarten, 1st, 2nd, I'm not quite sure that we would have enough time in the day to teach them how to properly wear a mask. When providing a child one mask per day, we ask, are these guidelines likely to be followed in a classroom setting? How much are their already shortened day, will the educators have to spend supervising, enforcing, and directing when our students are distracted by the masks? While I am concerned for the children's education, I also have a concern for our teachers. This really seems like an unnecessary stressor added to the seemingly ending list of obstacles that have added to their responsibilities this year. We kind of just ran some numbers with the county, and there are currently only 17 people in Warren County under the age of 17 who have COVID. 17 people under the age of 17. We struggle enough as parents, and the teachers struggle enough to create the days that they have to and fit the amount of information that they need to teach these students because of the shortened days. Spending more time on properly wearing masks is not efficient for the students. It's not efficient for the teachers. So we're asking you, please consider not requiring these elementary students to wear masks. They have been through so much already because of this pandemic. Do you have anything to say? Okay.
I personally feel like when I'm wearing a mask, when I'm breathing, I really don't like breathing hot air, and I'm doing that all the time because the mask is trapping the air. And then my brother, he is always like my mom said, he's always fidgeting with his mask, and if he were to be following the guidelines, then that means he would have to be washing his hands all the time.
This is coming from a very healthy 5th grader who is 9 years old. I did not tell her what to say today. She had the choice if she wanted to speak today, and she has bravely decided to speak today. So this is what we put forth. We have the questions. Even if you need to figure out what those answers are and put this off for a little bit longer to discuss and find those answers, we just ask that you guys answer the questions. You know, we as parents weren't given an input. We got one before school started back, in June or whatever, when we decided to have a late start for Irving, but we haven't heard anything since. Do parents still feel the same way? And I know we're trying to get more students back into the classroom, but I have a feeling that the mask mandate will force more students out of the classroom. Because for the fear of, what if my child has a waiver? Are they gonna get picked on because they don't wear a mask? And then if they get COVID, they have to go home anyways. The whole class has to go home anyways. It's not fair to these kids. It's not fair to the teachers. So we just ask that you guys please consider all the concerns from these parents who've gotten together, the emails that you've received over the weekend. I'm sure you received a few of them from both sides. We respect every opinion on it. Everybody has their right to speak what they feel, masks or no masks. No judgment from us, so. Okay, good?
Thank you, Danielle.
Yes.
you.
Thank you guys for
Reagan.
hearing us, we appreciate
Hey,
it.
Reagan, you did a great job your first time speaking. Good job.
Thank you,
Thanks,
guys.
Reagan.
Appreciate it.
Thank you.
All right. Now we can do the consent agenda. We'll go ahead.
On the Ventureland thing, is that a refund if we don't get to have that?
I think it's,
Or are we locked into it no matter what?
well, no, I don't believe they charged us last year. They've done it there every year for several years at least, and I believe they just kicked it over to this year
So they
from
had
last
Yeah,
year.
they had a $1,500 deposit that they had put in,
Okay.
so that just carried forward to this year.
Okay, so that's what I was thinking.
So
So
they
they weren't
put-
penalized, last year.
So they didn't put anything in the contract this year that we don't get some of that back?
I don't know.
Not at this point.
Okay.
yeah.
I'll move approval of consent agenda.
Okay. Motion made by Ken to approve the consent agenda,
I'll second it.
seconded by Donna. Any further discussion by the board? All those in favor say aye.
Aye.
Any opposed? Motion carries 7-0.
Anyone have a pen I can borrow?
Here.
I have a pen with no paper, so
Thank you.
you can give that. Does he have another one? Okay.
I have paper.
No, I'm fine. I just like
How do you
standing here
use
with my
this?
messing.
My paper, I have a big
Yeah,
notebook.
And then pen paper, so move your hand.
Cursive or regular?
Well, whatever, I write cursive usually, but it will work with printing.
Thank you, sir.
You're welcome.
Purple.
I have black if you prefer.
No?
Okay.
All right, we will go ahead and move on to letter G, number 1, the return to learn plan.
Yep, some of this is just informational, and, you know, we keep on here as an agenda item, updates, and, for example, and I see autocorrect, darn it, typo in there. IHS, autocorrect always becomes HIS, and I didn't catch it, I apologize. But there you have the current percentage of remote learners by building, and also that after kind of studying our hybrid plan and having some listening posts, doing some surveying, that currently we're not recommending changes to the instructional plan at this time. There's a rationale there that's kind of laid out with bullet points. And basically what it comes down to is we still are trying to work and do a better job, although things are going about as well as can be expected, but we're still trying to perfect what we do with our remote learners. And at the same time, we were talking about potentially coming back and shortening that time that we have for them. There was high level concern for those people who are doing remote learning. There also was high level of concern by teachers thinking about, you know, how could we do this with any less time. That's just a summary of several of those bullet points. We do still continue to look at options that we can provide support without changing the schedule right away. And you know, those are things that we are working on. We're aware of the strain that kind of everybody has. But there is some very good work being done too, and I think majority of people recognize that we're really working hard to try to serve people well, whatever their home situation is.
Art, in the
Yep, go ahead.
other districts are on the hybrid plans of all types.
Yep.
I'm only aware of, from following just in a general Des Moines Register, only 1 or 2 that are bringing all the kids back. Are you seeing any general movements or any comments in that regard?
The only one in the area that I've heard recently that plans to bring everybody back, I think in November, is Bondurant Farrar. Is their move, is Johnston considering that?
Yeah.
I think Johnston. So I mean, it is,
Well, he's been going all day, all along.
okay. Okay. So I haven't heard of lots, but, you know, that'll be the conversation, you know, as people continue to track the virus. I have heard others say that it's, you know, as people are getting their flu shots now, I don't know if you are or not, but we're entering season 2 where we're not sure how COVID will play with regular cold and flu. But for us, it's more on the practical level. How can we serve everybody well and not burn our teachers out? Yeah, we're still working on that. You know, I have there as well the mask idea, and I just want to give a little context about where we've been, where we're going, why we're talking about it again tonight. And as you heard Ms. Burrows share, I mean, there are varying opinions, experiences, and family situations regarding masks. That was true in July, that's true today. I would say as a general statement, most small rural school districts do not have a mask mandate. Most larger metro area districts do. And we're a little bit of a tweener in a lot of ways. We have kind of a compromise position, I guess you might say, in July. If you want to hear a list of yes and no schools, I went back and looked at a questionnaire we did for Heartland AEA. I could run through schools that do and don't if you want to hear that. If you're not interested, I don't have to. Any desire in just hearing a quick rundown or? Okay. Yeses, Ames, Ankeny, Ballard, Baxter, Bondurant, Farrar, Boone, Carlisle, Colfax, Mingo, Dallas Center, Grimes, Earlham, I-35, Johnston, Knoxville, Madrid, Martinsdale, St. Mary's, Melcher, Dallas, Newton, North Polk, Norwalk, Pellis, Adel, Southeast Polk, Waukee, West Des Moines, and Woodward Granger. No's, and most of the no's, you know, encourage it. Audubon, Carroll, Linville, Sully, Nevada, PCM, Pleasantville, Roland Story, Southeast Warren, West Central Valley, and Winterset. So those were just the ones I could access very quickly through this questionnaire we had. And I made that general statement about some small rural, or most small rural districts not requiring. You heard a couple that did, and you heard some districts that were a little bit bigger that don't too, so that was a generalization. You know, since our July decision, a couple things have changed, and I've had board members express interest in revisiting this, having a new conversation. The American Academy of Pediatrics did strengthen their recommendation for masks. That was one source that we leaned on with the recommendation back in July. They have come out and more clearly said that they should be worn. And they say ages 2 and up, which is kind of a CDC thing. Originally, we talked about language they shared that said that the benefit needs to outweigh the potential harm, which I think is what we have to weigh here. The kinds of things that Ms. Burrows talked about are real concerns in terms of contamination and wearing them properly and monitoring all those things. Those are good questions. So one change has been with guidance there. Of course, the bigger one and more recent one is the Iowa Department of Public Health and the governor that have released new contact tracing and quarantine guidelines for the state. And just to recap those, they have said that if the person who tested positive and the person who was exposed both were properly wearing a mask at the time of exposure, then the person who was exposed does not have to quarantine as long as they're asymptomatic. So there are ifs in there. If it's determined that the person who was a positive was not wearing a mask, well then anybody who was within 6 feet for 15 minutes or more would have to quarantine. And if likewise, if the person who was exposed was not properly wearing a mask during that exposure, they would have to quarantine. So that was one of the questions that was asked today. And I think, you know, it's important to note we haven't had large outbreaks, but had this rule been in place during some earlier quarantine decisions, there would have been some more schools or some more students able to stay in school under these rules. So that again, that's something you have to weigh. There definitely would be management with mask wearing. You know, we really talked about that a lot when that decision was made in July. And something else that has been clarified since our decision in July, this has been clarified both by the Iowa Department of Public Health and Warren County Public Health Services. Face shields and gaiters would not give you protection, would not qualify. This is specifically face mask. So when we passed the requirement in July for staff and for students grades 6 through 12, we said face coverings when physical distancing can't be achieved. Okay, and we have been allowing gaiters and face shields to count for that. One of those districts that I mentioned being a yes district was using face shields for their elementary. I don't know if they've changed that or not. So if you do vote to make a change tonight, then I think you can decide whether or not you would, you know, amend the previous requirement to face mask versus face covering, or if you don't, people are just going to have to understand that a gaiter or a face shield does not qualify under that guidance. So the people just need to know that if that's not a change. And I'm trying to think if there are any of the questions Ms. Burrows raised that I haven't covered. You know, staff would have to try to manage this, observe it. Oh, the physical distancing thing, it's in our return to learn plan now that we will try to achieve physical distance with students that have waivers. We currently have 11 waivers, I think was the number, Ray, is that right? 11 waivers in middle school, high school right now for either medical or religious reasons. I don't know how many waivers we would have in elementary. And my recommendation, if we do make a change tonight, would be to make this effective November 2nd. That would give us time to ensure that we have mask on hand, would give people some time to practice and get used to this idea, and would also give people some time if they want to seek a waiver to do that.
So what's the punishment if they refuse to wear masks? Are they sent home for remote learning permanently?
Well, we're not approaching it like a punishment or a punitive thing, But I've had one case this year where I've had to have that conversation with parents and say, we've made a choice available to everybody, and there is a mask or a face covering requirement in the secondary school, and if you refuse to get a waiver, or if you insist on coming to school without a face covering, which is required by board action, then ultimately you will have to select the remote learning option. Now that one family I talked to did go get a waiver, I'm told. So, but I've literally had that conversation once, or on a board with school, and our approach has not been to try to be punitive. I mean, we're trying to be respectful of different opinions, different family situations, and not make it a fight. But at some point, you have decisions, you have policies. If we have something that is mandated, we're going to try to enforce it as well as we can. So that's kind of what I have to offer, just for background and context. I can certainly try to answer questions if there are other questions, but I imagine the board, like I said, I did have some board interest in renewing this conversation, so I really don't want to dominate the conversation. It really is for the board to talk about and vet and decide whether or not there's an action tonight and what that action is.
One question Danielle asked, though, who would be responsible for knowing or determining that it was worn properly? Who does that fall on?
Well, I think the people, just like with anything else, the people who are supervising the students, which is going to be your classroom teacher most of the time, that as we do contact tracing right now even, the principal is helping Warren County Health to contact tracing the people in the building, but they're going and talking to the classroom teachers. Did you notice, like if we find out that, I was positive and you were exposed to me, then the principals are going to be asking that questions. Hey, those questions, did you notice, was Art wearing his mask properly? Was Ben wearing his mask properly? Or, who did you see in close contact with Art, and who can you verify they were wearing their mask properly? So it's going to be the people who have the knowledge that are tasked with trying to manage that.
Well, one thing I was gonna kind of call out, just from a practical standpoint, and I'm not trying to weasel through what they define as being properly worn, but, even like the note here where it says properly worn is covering your nose and mouth, it's not like they forgot to wash their hands the last time they touched their mask.
Right.
Some of that stuff is to protect yourself as much
Yeah.
as possible versus transmitting. So I'm assuming it's when the governor says wearing it properly, they're probably saying it's on their nose and mouth.
That's
So
the
that you're
guidance
not
we've been
projecting
Yeah.
out.
Exactly.
So I think that it's maybe not quite so ticky-tacky as far as like how many times did they wash their hands or touch it, and when did they, you would want them to, but I don't know that that's in the definition of the governor saying.
I think that's a very valid point.
Yeah.
That is the guidance we've gotten from the governor and the Department of Public Health. Worn properly means you're covering your nose and mouth.
Yeah.
That's what we've been told.
For the transmission part, rather than maybe you picking it up with washing your hands a lot. Yeah.
So that would save us from the transmission, or that would keep us in guidance with that, but it would, to go a step further, I guess, if they're touching it like that, and then you got all the kids putting it up against their face.
Yeah, and I'll be honest, one reason I think we're having this conversation is just whatever you believe about masks, is just a pragmatic thing, the change in the contact tracing, and, do they meet that definition? Can they stay in school? Because as I said, we have not had big outbreaks. We've had a few positives, and Mimi updates each week, and we haven't, we're still in that, we can't give a number because we're under, is it under 6?
It's under 5, yeah.
We're under 5, yes, so, we haven't had big outbreaks, but we have seen the impact of quarantining also. So I think if we do have a change, we're going to want to try to maximize those contact tracing rules. Rob and I have talked about this briefly, and I've kind of put it on the radar of our elementary principals. Right now, we have 15-minute elementary lunches in the classroom, which is right at that threshold for contact tracing when, kids are unmasked when they're eating lunch. Okay, so what can we do to either try to positively impact the physical distancing, which gets tough, or impact the time thing and shrink it down a little bit. And again, anytime you set a standard or a rule or your arbitrary 6 feet, 15 minutes, okay, it's not like the virus is going to care if you're at 14 minutes or 15 minutes or if you're eating lunch or not. But we know those are standards because you have to draw a line somewhere. So, I think your point again is very good, Carolyn, when we're talking about actual benefit and staying healthy and staying safe. We've heard the governor say it 50,000 times. The best thing you can do is stay home if you're sick, so you don't spread it. Wash your hands, keep distance. And then some of these other things are getting into finer points, but they are the rules and the guides that we're being given to play by right now. So we have to decide what's most advantageous for us.
I think we're stressing if you're saying you want to cut the lunch down to 10 minutes. I mean, that's shoving your food in your mouth and getting back. I mean, I don't think that's healthy. And
Or if we don't do that, then one time a day will destroy that whole day.
right, I understand,
they
but my
have-
thing is, how are you going to have? We struggle in here to keep masks up, and then you're asking a kindergartner to try to keep that mask up so it's over his nose, or
And they have seating charts, so it wouldn't automatically be the whole room, but it would be that pod, that people are within 6 feet, when they're eating, so.
Would it generally just be right around?
Yeah, I mean,
Or
classroom,
something.
and I'd have to give a really good answer, I'd probably have to do the math, the square foot of the classroom, or we might have to go actually see the classroom and how it's set up at lunch. But my understanding is they sit in the same place every day, so they're around the same group of kids. My guess would be during that 15-minute period, they're probably within physical distance of 5 or 6 kids, would be a rough guess, so.
The lower the elementary goes, the harder it is. The contact tracing that we've done in the lower elementaries, I mean, it's 19 of 24 students. So, they're moving around in that
yeah.
attention span, and how many different times they have to change direction. It's really hard to keep those kids separated any more than just the whole class.
The first thing I think of is the overwhelming vast majority of our parents want children in schools. We're down now to one school with only having 7% online, highest one's around 15%. So we know that's what parents want. And I always follow what other people are doing. This is State Department of Health or whatever it is with the governor. They're suggesting a way that in a situation, there can be less people that have to stay out of school quarantine. So to me, that's a plus. And it also falls into what, for the most part, the American Pediatric Association did when it changed and upped its guidelines. The only difference is they said first grade up. What was mentioned tonight was kindergarten up. But it's a way to keep more kids in school. I don't ever want to limit our kids or underestimate them. I have grandchildren at other schools that they've worn masks in elementary, and they get it as time goes on. I'm sure if we talk to the schools that have the masks from the beginning, we're going to hear they do it, they can do it. So it makes sense to me. It's a way to make sure we can keep more kids in school.
I talked to teachers in Ankeny and Waukee who've had it all year long, and they said, surprisingly, it has not been that difficult. They said, yes, every class has had, one or two, but they said, actually, it's worked much better than they ever thought it would. And they had the same concerns that, this was brought tonight. People said the same things, but I can give you the names of people I talked to, but they said it has not been that big a problem. And quite frankly, I think that at some point, you have to say, the reason you're wearing these masks is mainly for other people, that you need to learn to care about other people's health. It isn't just about you. So, anyway, I don't think it'll be easy. I understand everybody's reservations about it, but I think in the end, it's something we should do.
I also think too, I mean, we've kind of taken that approach, like try something, see what happens, revisit. If we end up doing it, we can revisit it. If it just comes back that kids just can't do it, it's not going well. I mean, I guess I'm kind of, I wouldn't say on the fence, because I've always leaned towards doing as much as you can to keep kids in school and all that. But, you know, if for some reason it just seems like it's futile, I think we could look at it again. I mean, I know we're not quite voting on it yet, but that's my opinion. I've always felt like we should do as much as possible to protect everyone, teachers, other students, families that are at home.
I think there's been some pretty good points brought up, and I'd like to thank everybody for their input that emailed us and has spoken to us on this issue. You know, there's lots of opinions on either side of it. The most obvious thing to me is, like Ken said, our goal is to get kids in school and stay in school. And I think all of our goal is to eventually get to a full day where all of our kids are back in class, and this could be a step towards it. Based on the guidelines, it would eliminate any disruptions. I think it would also encourage some kids who are online to come back into the building. We've heard from several parents who basically said the reason their kid is not going to school right now is because of the mask. So it would probably may shrink some of these numbers of kids coming back, and then also with the change in guidelines from the American Academy of Pediatrics. I struggle with this because, personally, I have 2 kids at home who would be very, very upset with me if this is what they had to do. But it's never about me or my kids. I try to approach everything what's best for everybody, and I think that's the most important frame of mind to approach this. And I look at it as, if we were to have a disruption, if I personally was going to have disruption, I'm fortunate enough to have a job where I could alter my work and stay home. But I realize there are families that don't have that luxury, and a quarantine could totally disrupt their personal lives. I also realize personally I'm fortunate enough that I'm young and healthy, and I'm not that fearful of this virus. I think I would be okay, but I realize there are other people in different situations, or might live in home lives where they're caring for older people. And so I think that's the most important thing for people to understand is, it's not about me or you or one person. It's about what's best for the majority of people. It's like I coach several youth teams, and I always tell my kids, be a good teammate. And I think that's the best thing we can do in this, is just be a good teammate and do what's best for the whole. And I think the advantages of this far outweigh any negatives. And I agree with Carolyn. I think this is something we should revisit every board meeting and see how it's going, and we can always adjust. But I think there's advantages to working towards what our ultimate goal is, and that's to get every kid back in school.
But we gotta make sure that people listen understand that just because we mandate masks, if they're not worn right, we still could be sending a whole class home. So, I mean, people need to know that. They need to make sure they understand when we pass this, that if they're not wearing it right, you're still sending everybody home. And just, because not every kid in that class is gonna wear it right. I mean, that's what I feel, but, I mean, we watched Irving and they struggled with the mask, so.
So are you wanting to also mandate what type of mask to be worn and no more face shields?
It takes a lot of teachers out.
Teachers have face shields that have a thing on the chin. Is there a kind that they can wear that?
It doesn't matter. What we've been told is it has to be a mask, that face shields and gaiters do not qualify. Now, what I've heard is that most of our teachers are wearing masks, although an example of use of face shield would be small group reading, where it's important to see the letter signs and things.
That's what I was worried about.
But there again, you can do yourself a favor by keeping the close contact less than 15 minutes. So I guess that would be my encouragement, that I wouldn't say there'd never be a time that it would make sense to wear a face shield. I can tell you too that you know, in this room, we have the ability to distance, okay. You know, I don't wear a mask every second I'm in here with 3 other people if we're sitting totally across the room. So, I mean, I think we have to keep in mind the definition of close contact, which is, again, it's arbitrary, but it's within 6 feet for 15 minutes or more, and then with the approved face covering. So if they're not gonna have, you know, all parties with masks worn properly according to the Government Department of Health's definition, then hopefully, you know, they're watching the duration, you know, and limiting that contact.
Is there any way they could like open up the lunchrooms for part of the classes and have, you know, and then?
We've talked about that. I know our food service director is definitely willing to do that. I think again, the time crunch we're in makes that difficult. And that's really an elementary issue. Middle school, high school, they
Yeah,
are
I know
open.
it is.
They have the ability to spread out, okay.
Right.
We have been delivering meals to the classroom, and the 15 minutes, you know, we've heard from elementary principals that, you know, that's impossible right now to get kids to the lunchroom. And maybe you have something to add, John. I know you've talked more with Abby. She would like to get, like kindergarten, for example, into the lunchroom, be able to spread out. What do you have to add on that topic?
The other piece to that is she's spending a lot more of her funds because it's, right now, they just put everything in the box, in their meal, give it to them, whether the kid wants it or not. If they go through the line, they get the offer versus serve, which is, I don't want these, but I'll take this.
Right.
And that's a legitimate way to, and then she would
Yeah,
save.
and I just didn't know, I just didn't know if it was gonna be the box lunch for everybody and just say, okay, today, you know, these 8 are going down to the lunchroom to eat, and then, you know, the rest of the class is gonna stay here, and then you wouldn't have to I just didn't know how, you know, how big I know how the big lunchrooms are at Irving and Whittier, but I don't know it,
Yeah.
the other two.
I think we need to continue to look at it. I think, you know, obviously supervision would come into play if you started splitting off groups.
Right.
You know, we also have, you know, teachers have a 30-minute duty-free lunch, as do associates, so figuring out, you know, who's supervising while others are eating. And
Right.
so I think that there definitely are schedule challenges to just bring everybody back to the lunchroom, but that is an area that we continue to look at.
Because there are some kids that are done in 5 minutes, and there are some that aren't done in a half an hour, so Lori's right. I mean, it's, you know, it's hard to tell everybody to do that.
So I think if we do make a change, I think we need to continue to look at, I think I used the phrase early on, how we can maximize those beneficial contact tracing rules. You know, so we want to look at every situation that we can to try to make sure that we're following within those direct contact guidelines so we don't have to quarantine. I agree with Rob, if you have that 15 minutes of a day that's gonna sink you, you know, then you lose a lot of potential benefit. So.
Can the teachers teach in front of the classroom with just the shield on as long as they're 6 feet back?
Yeah, if they were physically distanced, that would meet the requirement. That wouldn't count as direct contact. Yep.
Well, everyone knows my opinion about wearing masks. It hasn't changed since July. And I'm frankly tired of beating the same drum over and over again. But I think a few things. Two, we've had a lot of people reach out to us in emails that you guys received too that are a case-by-case situation, a deaf population that absolutely has to be lip readers. So knowing that we need to make sure that that population is taken care of as well, because they could quickly go backwards in their education too with a mask on. I feel bad that we are putting more on the teachers' plates because it could be a lot on them at elementary. And so I know that they're already, some of them are already maxed. So I feel that them having to manage this is the only way to have it be successfully done. But it is another thing that they are going to have to deal with. I also want to make sure maybe at the elementary level too that we make sure that we would be providing all those masks as well too. You know, I've had
a lot of people wear disposable masks 5, 6, 7 times, and that scares me. Also, just with the cross-contamination, then maybe that's something that we just have to continue to educate our teachers about as far as that goes. And I think whether you wear a mask or not wear a mask doesn't say anything whether or not you care about other people or don't care about other people. I think that, again, it's every family has their own situation, and every family has their own reasons for the decisions that they've made. But I also, for a living, see the financial strain that this is putting on all the families. And I'm seeing, when people have to go into quarantine that don't have the sick one, the childcare strain, the remote learning strain, the financial strain that goes into all that. And, us being part of that whole 6th grade debacle there at the beginning of the year with quarantine. So if it means that we can keep more people in the classroom and less people are caught off guard by having to find childcare and financial and stuff like that, then I think we probably need to start that way. But my big concern is that they are worn correctly, because I would hate for a kid to be positive in the class and somebody say, well, that kid wasn't wearing it properly, and that one and that one and that one took it off, and then we're in a whole different debacle as far as that goes. And I would, if this passes, that we have them, we mandate it for the elementary kids, I would just hope that the parents get on board with us and encourage them and stay active, because I think the kids are doing a great job at 6th grade through up with wearing these masks. I really think that it doesn't really affect them a whole lot, so I can only hope that that's how it'll end up at the elementary level. But I do have to talk about the mental health side. I don't know if you've seen the most recent research on the mental health effects of social distancing and wearing masks. Suicide rates in middle school and high school are at an all-time high right now in the state of Iowa, not just in these weird places all over. So I would just encourage parents to continue to talk to their kids about mask wearing and about their emotional well-being. And so I'm with Ben in the fact that this isn't about me, it's not about my family, but it's about the families of this community. And right now, if it means that we can help some not have financial strain and emotional strain and childcare strain and remote learning strain, then I think we probably need to do something, but with very much in our mind that this decision can be taken through and it can be revisited if it needs to be revisited. Because I also don't want masks to be a false sense of protection either as we come into the flu season, right? So all of a sudden, well, my kid's got a mask on, it's only a 99.9 degree fever, so I'm gonna send them, right? And I think, they made it, oh, it's just the flu, it's not COVID, so I'm gonna send them because they have this mask on, they're gonna be protected anyways, and I can't take any more time off work. So that too is a concern of mine, so.
Are the teachers taking their temperatures when they come to school still or not?
I believe so. We haven't had any change in the return to learn plan as far as we know, correct? Yeah.
They're still getting.
Yeah.
I know I've seen, even at the high school, I see Mr. Lohman standing at the west door where kids walk in.
Yeah, I just,
Whenever they walk in, so.
Speak with a couple principals today, and I asked them how practical this was at making it happen. And one of the things that we brought up was just in having a mask break, like 5 to 10 minute mask break for the students, since the 15 minutes is the magic number with the state of Iowa or CDC, whoever. Anything under 15 minutes in order to just get to the letter of the law would be okay. So if they wanted a mask break for 5 to 10 minutes, I think that would be a nice way for the kids to be able to get used to it maybe. And I think we also need to extend that courtesy to the middle school and the high school students as well. That I know some teachers have, at least one has an area of her classroom that she set aside where a kid could go if they're having some trouble, and just needing to take the mask off and stuff, which I thought was really kind of her to be able to do something like that. Sadly, I don't think the rest of them have yet, but I'm glad that she thought of that and stuff, and I champion her for thinking of something like that, and I'd hope the other ones would also think of something like that for the students that are struggling.
What about recess for elementary?
What's that?
What about recess for the elementary kids?
I think Mr. Morris told me that when he was asked about contact tracing at recess time, it didn't seem to be a big deal with the state of Iowa.
They have zones,
Yeah.
so they are keeping the
Right.
same group of kids together, and you are outside, and whether or not you would be within 6 feet for 15 minutes at a time. What I've heard from elementary principals is fairly low concern about recess outside. In those cases, you have to have recess inside, it probably gets more challenging.
Yeah, that's what I wondered. I was just hoping they could take them off outside.
Yeah, I think they do,
I guess that would be something I would hope that would be okay with this board with that.
Yeah, they're not
There'd be
typically
time that
that
they
close
could
to
actually pull it down.
15 minutes, yeah.
You know, when you originally voted in, the requirement for 612 and staff too, again, the language was intentional. We said when physical distancing can't be achieved. And that does leave the door open for something like a mask break, for, a situation when you're outside and you can't spread out. I've been over at the middle school, for example. Penny Airy has her classroom kind of on that end. We've had such a nice fall. I've seen her class frequently outside spread out, and they're able to have their mask off. And when they're not able to, lots of times they're not in the classroom, they're all the way up and down that hallway in like lawn chairs more than 6 feet apart. So I do think people are doing some creative things and are trying to keep people safe, but also pay attention to the human kind of mental health side of it, like Sue was talking about.
Just to be clear, if a teacher had his or her face mask or his or her shield on and was distancing, we would still be good, especially if they were working with like a student with a hearing impairment or, speech, or somebody who needed to see that mouth movement, that we would still be good with that, right?
With the distancing, correct.
What are the speech clinicians doing?
Sorry, what was that?
The speech clinicians, what are they doing?
I haven't spoken with them directly, but I know that's something we heard early on when we were forming the plan, the importance of kids being able to see that, and that's one reason we made face shields available to any staff member who wanted them. So I have to believe they're using them.
Yeah, typically they're not there more than 15 minutes anyway, but
I'd be happy to move this to a motion position.
And what are we moving to a motion? Is it correct mask? Is it those types of masks? Is it gaiters, face shields, whatever requirements?
I'm not exactly sure how to word it, that's why I put it the way I would. I thought my motion would be to amend our current policy that all students and staff wear masks. Now, with that simple sentence to it, there's that part of the policy, because then you have your exemptions for distancing and all of that.
Right.
So I'm trying to figure out how to word it, Art. Can you suggest
that
anything
we
better?
want the teachers.
That's my thrust.
So no shields unless they're 6 feet
Yeah,
apart.
but we need to let if it's
Should
gonna be
that be
in,
the
the
motion?
teachers need to know
Yeah,
they
because
can
there's a
wear
lot
a
of
shield.
teachers
I don't
that
want
wear
somebody to come in
shields.
and tell a
And
teacher
to
that
make
they
them
don't
go
have to.
mass, I think,
Yeah, that's.
I think the shields are fine if they keep the distance, or if they do have to be closer, if they limit the duration, so.
How about, I move that we amend our current policy that all students and staff, without exemptions, wear masks, face shields may be appropriate if guidelines are followed. Would that-
so I have one other question. I know of 2 students at the middle school that are wearing face shields because of medical requirement. So are we gonna let them have to have another note? Or are we gonna let them wear face shields
No, I think-
because it's doctor recommended?
Yeah, no, anybody who would already have that in place, in a place where face coverings are required, we would make them redo that.
What about the gaiter?
The gaiters don't meet the requirement on the contact tracing, so I think that is a decision tonight. Either, if you don't spell out face mask, and I think I heard Mr. Breslin say face mask, if you don't spell that out, you know, then you don't get the benefit with the contact tracing.
So you're gonna have to say no gaiters, because 90% of your high school kids are wearing the gaiters.
The whole point of this is to eliminate the quarantine and keep kids in school, so I think we have to spell out what classifies as a proper face covering.
And really, it's a recommendation. It was the recommendations that you guys approved in July, not, it wasn't a policy per se.
Anything we do is a policy.
I think
Yes.
Okay.
if we've approved Gators to help litigate this virus for the last 3 months, I mean, our policy as it is working very well. Our numbers are very low, right? So if we've allowed Gators for the last 2 months, how are we now? There's been no research.
I know,
There's
yeah.
been no data on Gators. There's been no research on Gators. How are we now telling these kids that it seems to work better for them, that now they no longer can do that?
My response.
Because that would be, but that would be a parent decision. If they say, if you're gonna get contact traced and you're gonna be sent home because you're in a Gator, not a mask, that becomes then a family decision.
Well, it affects the
All I know
class.
is this thing over.
It doesn't affect the class.
If one person has a Gator and everyone else has masks, the
So
Gator.
it's the person that tested positive has the Gator.
Well, I think
And
either
the
or,
students
you're
surrounding
transmitting or
them.
getting, I mean.
No, I think,
transmitter for sure.
yeah, just to clarify, it would be, it wouldn't be if anybody in the class wore a gaiter, that wouldn't automatically impact everybody's contact tracing. If the person wearing a gaiter was the positive
Right,
person,
that would-
that would be an issue.
But if they
Or
were
if the
sitting.
person wearing a gaiter was within 6 feet of a positive person.
Right, so what I'm saying is if the family wants to continue with, yeah. But I'm just saying, you know, we had a policy that we're fixing because we need to, but it's not necessarily a broken policy.
Yeah. No, I think that's one of the key decision points for the board, if you are gonna pass something, and if you decide not to amend face covering to specifically say mask, then everybody just has to understand the risk they're running in terms of the contact tracing, like you were saying, so.
And to me, unless we say mass, it really doesn't make any sense.
I mean, I think that is one of the reasons we're here tonight, because of the new guidance that specifically says mask, so.
So my wording would then be that we amend our policy that all, to read that now all students and all staff wear masks.
Is that all K-12 students?
Yeah.
Okay.
And do we want in parentheses or somewhere?
Students and
Shields can be
teachers.
appropriate in some teaching situations, and gaiters are not appropriate. I mean, do we want that language in there? I'll put anything in there.
I mean, to me, that's a board
Okay.
decision.
Well, I mean, I think we
do
have to
think-
have the face shields if they, you know,
That
that
can-
face shields are appropriate if they're, you know, within the 15-minute timeline and they're 6
Within-
feet away from
Yeah.
the
But I
student.
do
Appropriate
think we
regulation.
need to continue to, there's a very practical reason for allowing face shields from the instructional standpoint.
Right.
and
They have to see their mouth.
I would never recommend doing away with that.
Yes.
I agree.
Yeah, I mean, I think we have to have the face shield in there. In the emotion.
But we have to put a qualifier, face shields,
And
as they
teachers,
meet requirements.
you know, or, yeah.
What
as they
requirements
meet-
are
as
there?
they
I'm trying to
meet
figure out how to word
requirements. I don't
it
think we have
emotion.
to spell
But
it
if
out.
a
I agree with
teacher,
you.
but if a teacher has decided that the face shield works better for them, whether it's medically necessary, classroom necessary or not, do they still have that choice?
Well, according to the motion, yes, if they're meeting the physical distancing
They meet
and time, and/or time guidelines in terms of direct contact.
But a student doesn't have the ability to do that.
So if a teacher is talking up front and she needs to go around and check work or whatever, then she's got to put her mask on and take her shield off.
Well, I don't know that she'd be in direct contact with anybody for 15 minutes, checking work.
Yeah, a lot of times you just
I mean, I
walk
wouldn't-
down and
I
look
wouldn't
down
think so,
and, yeah.
but-
It's not 15 minutes, yeah. I mean, I just think the face shield guideline has to be in there, or just very general, but needs to be in there so that they know someone's not.
I don't disagree with you, I'm just trying to figure out how to word it, you know,
Oh, okay.
at all.
You could just say meeting the current guidelines of, you know, and face masks are required and or face
You know,
shields.
somewhere at the words that we amend our current policies, that all students and faculty wear masks, and then face shields,
If they follow the
meeting
distance and
appropriate
time.
guidelines
If the, yeah,
will be allowed for teachers. Anything else I should throw in there?
So are you defining mask as no gaiter?
Oh, yeah, mask is mask.
And I think that needs to be loudly communicated.
Right.
In
Because there are a
parentheses,
lot of
mask is a
families
mask and
that
not
are
a
gonna
gaiter.
be teed up.
Put it in the regulation. Everybody understands what I'm after? Jonna, do you have enough in
I
writing?
have,
I'm working on something.
to amend.
Just a minute, Art's working on something too.
Okay, this is a little wordy, but I think this is what I heard. Amend district policy to require face mask for all K-12 students and faculty with provisions for mask breaks and instructional use of face shields within physical distancing and direct contact guidelines. Is that what I heard?
I think you need to clarify the,
Okay, okay.
Gator's not acceptable.
Sure.
So now, sorry. So are we giving people now time, so if they want to go remote, they don't want to wear masks, they've got time to fill out
Yeah,
and
my
go remote
recommendation
learning?
for several reasons would be not to enact this until November 2nd. That would give the district time to wear a mask, that would give people time to practice that feel like they need it, that would give people time to get waivers that feel they need to pursue a waiver,
But they can go remote, right?
or to make that instructional decision.
Spike for remote.
Just add effective November 2nd.
I do think I'd say something like, something about the Gators don't qualify under the
Yeah.
rules.
Let me
I mean,
read
just
one
so
more
that we're not
time.
randomly saying no Gators.
Effective November 2nd, amend district policy to require face mask for all K-12 students and faculty with provisions for mask breaks and instructional use of face shields within physical distancing and direct contact guidelines. Gaiters are not acceptable face coverings.
Per the CDC, gaiters or not.
Yeah, per the that's what, I would just do something like that so they understand why we're doing that.
And I would probably say per public health guidelines, because we heard it directly from the Iowa Department of
Yeah.
Public Health and the Warren County Health Services.
Okay. I will move that motion.
All right, motion made by Ken to approve the motion that Art just read,
I'll second.
seconded by Carolyn. Any further discussion by the board? All those in favor say aye.
Aye.
Any opposed?
Aye.
Nay. Motion carries 4-3.
We were the three.
Lori, myself.
Same three.
Sue. All right. Moving on to the next item is the board curriculum committee meeting report.
Did you put the numbers? Do we have those numbers up where the schools fell in scoring? Right, okay. So Ron, or Ray can bring them up. Did we have a chance to break them out, or are they still with everybody in it?
I didn't add any more information since we didn't
Okay.
cover that at the committee.
Okay.
I guess I'll start, and then Lori and Donna can jump in.
Okay. I didn't know, does Annette want
Oh.
to talk about what we need to approve or no?
I was just gonna talk about what we talked about at the
Susan.
meeting.
Just talk about the meeting first.
I think
but then
everybody
there
needs to
is
see the
There is
scores.
an action item. too.
Yeah.
there's-
Okay, the action items are what, I didn't know if she wanted to talk
You know,
about.
we can do that next, and I can give details on that.
Oh, okay.
So we just quickly, I don't know, for those of you that don't have kids in the school district, if you've gone on and seen the different student and parent apps on the Power School, they have done a nice job of putting all these certain apps in there. They're easy to find, they're easy instructions. So we talked about the different apps that were available to both student and parents on those.
On that chart across all those different things, do parents use all of those programs, all of those?
They can. The one I use right now is Google Keep because we need she's used to a paper journal, like what's due every day, and she was having a hard time understanding, so parents,
I asked
yep.
my question backwards. Are they getting material in all of these formats?
Paper material? Or what do you mean, are they, oh yeah, like
If
they're
you click-
uploaded.
If you click on it, they can go to any different area.
Yeah.
And it explains to you. And then
Everything.
some teachers use this or this, but
Yeah.
it explains, it walks the parent through what to do. Like, we can't do an example.
Oh, that's okay, I
Yeah.
can follow up later, I was just
Yeah,
curious.
so like on the app, I clicked on Google Keep, that's an app there for student and parent. And it shows me how a kid can upload her daily assignments to this app. Or how they can, if they're struggling with Google Docs, like how to get into the Google Docs and then send or submit something on.
It's very
So,
parent-friendly, I think.
Yeah, they did a very, very good job with that. We also talked about Team Legacy over at the middle school, put together a really nice PowerPoint for all the parents about conferences, but they went like math, wrote all the math teachers, all their emails, and then what to expect in that class. And they did that for all the core classes. So it was very nice as a parent to be able to read that because it answered a lot of questions. When you only have 10 minutes in conferences, it answers a lot of the administrative questions as far as that goes. So we talked about that. We talked about Seesaw, which is, again, so parents can basically be at work or at home or wherever, and a teacher can upload something about what's happening right in that moment in school, and I can see one of my daughters reading to the class and get so it's just it's a way for teachers to continue to communicate with parents and stuff on the good things our kids are doing. We talked about the SIAC committee, and we really did a lot of brainstorming as to what is this committee and what is our goal and mission for it. And so I would like to, and I talked to Rob, I would like to add this as a discussion item at our work session, just to see where we want to go with that. So that's what we did for SIAC, and then and then if someone wants to, or you want to talk about the fall literacy screening and results there.
Yeah, Ray, are you able to hit that hot link for Fastbridge Literacy? So our literacy data from the elementary up through the middle school is consolidated now in a site called Mirroring Student Success. And that allows us to compare data not only per building, but to break it down into disaggregated data. To the committee last year in the fall compared to this year in the fall. Previously, I think you were only able to see Irving because they had completed theirs early. It's approximately like a 10% difference, lower achievement of kids meeting their benchmark from that first screening. And so from there, each teacher analyzes their classroom data. They'll work with the at-risk personnel, their instructional coaches. We'll be taking a look at what are strategies that they can use whole group within that. But then they also take that to form interventions. And for kids who are significantly discrepant, they will get progress monitored weekly to look at that progress. So we're also taking a look at there's different curriculum material that we need to be looking at. We've been working with Sarah Baker because some of the students do have IEPs, and to make sure if there's anything else that we can fill in for those gaps. We're taking a look, for example, also at Emerson, their push has been for over a year now, volume of reading. How much are we engaging kids in reading throughout the day? So we're really trying to dig in on for every student, every class, and then for every teacher, how can we support them to get that gap closed? Most recently, too, some of the principals have started reaching out in communication with parents. And we're trying to compile here, not to put more on them, but even to get volume of reading at home. If the kids can read their cereal boxes, if they like to game, do they have manuals that they can read? What are things that we can do to form a partnership with our parents without overloading them to get more practice in outside of the school day?
Could you not pull that up?
No, that's not a link in the PDF.
Yeah, I've had a lot of trouble.
Yeah.
It was just
Getting
fuzzy when
stuff. And then I
it
went-
came through the report, it was just real blurry, you couldn't really see it
Yeah,
for some
and
reason.
if I go on, how I usually do, I'm having trouble printing some, the packet that's on our website, the link didn't work for me, you know, on this. So I've had a lot of trouble with these. Eventually I can get something, I can't print them, you know, so somebody can take a look.
Yeah, I just had a quick, so like, is there any way for the teachers to identify, like, are they able to look back at whenever the last scores were and see like, well, this kid was performing pretty well? Are they also trying to get the kids that maybe aren't below that to continue to where they need to be as well?
Yeah, it does say the historical data.
It does?
In
Okay.
Panorama, which was new last year. Prior to that, it did not say that.
Okay.
So that's been an improvement.
Okay, good.
I have this, Ray, but
As I say, we have this,
I have
I can't put
this.
that up. I can't.
Or why don't you just read off the percentages?
Yeah, why don't you just read it off?
Donna, just read off the percentages. Yeah.
Read it.
I can read it for you here. Wait.
Yeah, you read it, because I can't read and breathe and. I can't do it all.
With the fall 20,
Donna, I'm right there with you.
fall
My glasses
2020 at
bubble.
Emerson, there was, overall, there was 96% of the students screened, 68% at benchmark, K through 6, the goal was 80%. Emerson, 96% screened, 71% at benchmark. Middle school, 91% screened, 84% at benchmark. Irving, 97% screened, 71% at benchmark. Whittier, 95% screened, 62% at benchmark. And Wilder, 98% screened, 55% at benchmark.
What was the benchmark again?
80%.
And on a normal year, you know, we do expect to see growth from fall to winter to spring, and fast testing occurs 3 times a year. And it's usually remarkable,
Right.
the growth from fall to winter to spring. You know, because instruction matters, you know, the time between the teacher and student matters.
When you can tell they've been off 6 months. I mean,
Yeah,
we've
and-
been, you
Right,
know,
and you know, normally you have a summer break, well, this
Yeah.
year we had a March 13th
Yeah.
through summer break, you know.
a double summer.
So we will see growth. You know, I think I've heard Mr. President say before too, let's get them back, let's do as well as we can, let's not obsess about learning gaps, you know, right out of the chute in the fall. We are gonna see growth, it's gonna take some time. And I think it was shared, the gap between last fall and this fall, you know, is 10 to 12%. That's probably not unexpected with that extra time. So,
When did you tell us the second one was?
Right around January.
January.
so now if we're not seeing growth from October to January, you know, then I think we need to be very concerned. We're not doing the things we need to do in terms of interventions and looking at the data, so.
And my other question, I think somebody, or maybe Donna asked, the kids that were remotely learning, some of them did come in, correct? And do that?
They did come in on site to test, and some of the percentages as to why we didn't hit 100% was some parents did not feel comfortable bringing their kids to test.
Reading it.
You know if that was a big difference from learning from
just
home
reading
to in class?
I'm still getting the names of the remote.
Oh, she's still breaking that out.
Ongoing one at a
I'm just
time.
curious.
Yeah, to see.
Done at the other schools? When is math completed at the other schools?
They have them through, I think, the end of October, to finish around
All right. And then there is, go ahead.
We need to approve the high school, right?
Yeah, there's
That
a few
that
more,
class.
couple more things we talked about in the meeting if people want to comment on it, but we do have a curriculum change request tonight.
So at the high school, and you guys remind me, high school, we're gonna add the class that's gonna teach bookkeeping or
Financial literacy.
financial, and it's not a requirement this year of seniors, or it is?
I think you're talking about the
Yeah.
school.
The financial literacy, yeah, has been
Right.
added to the goals. the
There
financial-
is a financial literacy requirement, and we do have that integrated into one of our courses that all students are taking. So we're meeting that. That's just a state requirement.
Right.
The course that we were adding deals with the school to career program we're working on.
Yeah, sorry,
Yeah.
I had that confused, sorry.
So, yeah.
Can you explain that, the school to career?
Nice. So last year, Jamie Busby was hired as the multi-occupational careers physician. So this is that next step to where students this spring for the following school year would be able to sign up for this course that's being called School to Career. And within that, in the beginning part of the course, the kids can be studying their careers, making sure they're getting prepared for that. The second part would be a supervised work experience in the community. And so it would be offered for concurrent enrollment with DMAC. So it's that next level of career development for students, so that they have a pathway and be able to really get some hands-on experience with careers, hopefully too here to support our Indian-owned businesses.
Right.
Yeah, there are so many benefits. You get the college credit, you get the work experience, you get to help local businesses with labor force, and that first quarter that Annette was talking about, where they're laying a foundation, you're also working with students on what they used to call soft skills that people now are calling essential skills, showing up, being reliable, being professional. So I think this is really one of the great things that's coming about from a focus on that school to work. That was an area that we've looked at for several years. We've added some things for some of our special education population. This is a great next step, as Annette said, after hiring Ms. Busby with that multi-OC certification.
Great. Anybody approve that?
So that is an action item requested tonight, that major curriculum change, if somebody would like to move.
And she's gonna start working with our local businesses, like trying to get internships or apprenticeships or whatever you call it.
Yep, and that'll be part of her job, will be to check on the kids at work, to communicate with the local employers. Yep.
Do you have any idea how many students that might be? An estimate?
I think they had estimated first to be about 20.
Oh.
I think that's what
To get-
Jeff said, was
To get
20.
started. That way, we would be able to keep that contact and management with them.
Yeah.
I'm going to move approval of adding the school to career course.
Motion made by Carolyn,
I'll second.
seconded by Sue. Any further discussion by the board? All those in favor say aye.
Aye.
Any opposed? Motion carries 7-0. Next, we have the monthly financials. Take it away.
The year is finally over, which is good. Drags on, anyway. We can talk about where we ended the year, but it might be better to go through the year-end reports. Because
Yeah, however you want to do it.
This gives a synopsis of it, but I think that if we look at the financial reports, we can go through those, and that gives us more drill-down information if people are okay, unless someone has any questions on any of the financials.
So John, how come the other was more, I'm just curious.
The other is all our bond refundings.
Oh, okay.
So even though we save money, we have to show it as it came in and it went out. So anytime it looks at budget, so that's why we have to, when we, in May, I believe, we did a budget amendment. That's the reason for that. So it's more a booking in and a booking out, but it has to show as.
Okay, yeah, I looked at them, I didn't know what other was, and I thought, okay, so why, because the others were.
We're looking at all that money, right? That
Yeah, I
should be-
know, yeah, I thought, okay. Well, and I just knew that the others were lower, for this year, so that's why I was asking. Thank you.
Okay, we're gonna go on and talk about the year-end thing,
Year-end,
right?
so- mhm.
So I will move that we approve the monthly financial reports for June 2020.
Motion made by Ken to approve,
Second, sorry.
seconded by Donna. Any further discussion by the board? All those in favor say aye.
Aye.
Any opposed? Motion carries 7-0.
Okay. We finished the year, as you can see, I kind of gave you a kind of a summary of each of the different reports that we do. The certified annual report is what we submit to the state. showing most revenues and expenditures, your change in fund balance, and different specific things. So I always think it's interesting to look at, how much local, which means local property tax and stuff like that, that is your $12 million amount. State is your state aid, which is still, there's part of that is your property tax or your other taxes as well, probably. But that's twice as much, Federal is, we have Medicaid, this is all in the general fund, by the way. So Medicaid, Title I, we have different programs that are federally funded. It is a very small piece to that, and that other is just a transfer. It's a very small amount. But so you see that our total revenues were $38.4 million for the year. The next page, when you get to that where it talks about specifically assigned balances, those are things that carry over from year to year. Ray, can you go back? 3 more pages. It'll show, keep going. There. So those are areas that we have a little bit of carryover. They are state or local, mainly, projects that we have. So you see, Gifted and Talented had $6,000 left over. That will ebb and flow a little bit. Usually they do spend it all. They were a little shy this year. The TLC program, $131,000. Preschool, that goes probably ebbs and flows as well because, you get it a year later. So last year we had a very large program, group of preschoolers. This year we have a smaller one, so we're going to see that move around as well. Teacher salary supplement, that's the TSS money that our teachers get as supplement. They get everyone as a full-time equivalent gets $6,100. At the end of the year, it's over $1 million for the whole year. We try to balance it out, so we try to keep it a little bit in there or zero it out, but it's hard to zero out exactly. So that's what the $15,000 is. Early literacy is a program where it's all about literacy in the lower grades, like K3, I believe. And the TQC, that has grown quite a bit, that amount that we're carrying forward. But we had a lot of people going places that didn't go this last year. So this district has been very good at getting their teachers and staff to go places and learn new things.
Are they switching to remote?
Some of them are remote. When it all happened in March, we had refunds like crazy because we had already scheduled everything. So this year may be better. It is cheaper also because, for example, I just changed one that was a $3,200 if they came in person as a training here to $900. So there may be some cost savings there, but that will show that as going up. So totally, as I call them categoricals, restricted balances going forward, we have $620,000 out of a $38 million budget. That's still not very much. Your goal is to use those funds up first, but to some extent you can't. We want to make sure that we're using for the right thing. So that piece is.
What does TQC actually stand for?
Teacher Quality Committee.
That's what I thought, Teacher Quality Committee.
Teacher leadership is the TLC. And teacher salary supplement is the TSS. A lot of TLAs, 3-letter acronyms there. Moving forward, then you can see the acronym, or the expense side, or excuse me, revenue first. So you'll see revenue, again, you see every fund across what we have. Then you'll see, keep going here. And this piece, the general fund for the expenses are, there. So it shows the $39 million. So that's where we're over about $660,000 revenue short of expense. We've seen 39,078,000 was our expenditures. And you'll see as we go through the special ed supplement, we were increased over 200,000 in that. There's other pieces that are either, it's hard to pinpoint just exactly one thing because we did have savings. We didn't have transportation, bus costs that we would have had, fuel costs that we didn't have, paper costs that we didn't have. So in trying to balance it all out, we did reduce our, our expenses over our revenue by the 600,000. But financially, we still are in a very good position going forward. And you can see.
Our earnings on investment, that category just go into the general fund?
It went to every fund, yeah.
Okay.
So you'll see that's in the revenue.
Yeah, I saw it. I was
Okay.
curious where it went.
Yep, so, and we did get a call from the bank that said that right now, bank interest for most people is 0.00. They are giving us a little bit of, they're giving us 0.15, which is better than 0.00. We have, because we do have funds in there that we have earned quite a bit of money with that. Now, we may not, so sadly, but, let's see. Trying to think of what, as you get to the, every fund, it'll break down every fund because we have to show that. The treasurer's report, keep going down, right, get through all the funds. You'll see the starting and ending of each of the different funds. General fund being the one that we watch the most. Sometimes that isn't always the biggest, but typically it is. If you had a bond issue or something, that would be a large dollar amount, but right now, general fund is our keep going. There is our largest one. Kind of a summary of what we've got. You'll see that enterprise is negative. That is our food service and childcare. No matter what, that was really hard on our food service did end up in the black. Our childcare did not. Even only having the 4 site directors there with Kim and the assistant, we couldn't cash flow because we had to physical distance, so you have to have more staff. I want you guys to know that we may need to do something to help that fund, and I would need to find out what steps we need to do to take to get to that. But I don't know how they're going to dig out if that's the case. So.
Typically those enterprise funds, they're expected to be self-sufficient. They
It's
have to
equal.
sustain themselves. You can't carry it with your general fund, but I don't know if there have to be a number of schools that are experiencing pressure that way after the spring we had.
Right, and we were one of the only childcares that operated. We were the only metro childcare that operated. Everybody else shut down. So kudos to our staff, and they did it, and it worked, but to an expense that may have to be.
So is it-
How much in the hole?
Well, if you look at, it's not 900, it's more like 100,000 cash. This shows the booking of IPERS and other expenditures that
Okay.
aren't really true expenditures, they're more of a booking.
So is there still COVID, I know we were talking about there's still COVID expenses, are we still counting money that we had got to help COVID?
We tried to.
We can't use that,
We used,
how's that work?
remember probably in June or July, I think it was July when we did the transfer, we had $248,000 from COVID, the original.
CARES Act.
And we did a transfer from food service and from childcare, or two those from the general fund. So we helped them a little bit, but not enough, right? So, because I was trying to justify, even having their people there, that you have your 4 highest paid staff members doing the work that typically you have hired people.
Because they broke them into 4 sections, right?
And then very few, very small groups, it just doesn't cash flow, obviously. So about $100,000 is where we are right now, approximately, so. It shows that the next piece is a summary transportation. It shows you different pieces of that. We'll go into the transportation one as well, that breaks it down a little further. The next, let's see, go to the next one, Ray. The next one shows our miscellaneous income, so you can see how it's calculated, but the real information piece is the very bottom line, which is our cash reserve levy that we can cash reserve next budget cycle. So this last year it was 320,000. This now it's 141.4 million. So that gives us some ability to, as we look at our property taxes, we can cash flow some of that, or we can bring some of that in, or we can not. You know, it just depends on where we are with our budget. So. And the last pieces are just our long-term, either long-term debt and our assets. So that's kind of the pieces for the certified annual report.
One of the categories in there was community service operation for all funds. That was the general heading, and it was $521,000. What's included in that? I mean, just in community service operations.
500 and, I don't know which, I guess I need to see which, is it an expense or a revenue?
Expense.
That is, okay, community service operations,
Oh,
I believe is childcare. If that's our enterprise fund, yeah.
Okay.
Yeah.
And I saw in the management fund there was $36,500 for salary.
That would be the $1,500 that we did for the early notice.
Thank you very much.
And that was prior to the payout. Okay, any questions on the certified annual report?
You have no works of art or historical treasures?
We don't. Where I was before, we had some Christian Peterson ones, and that was an interesting way to do it, so yeah. No, we don't, at this time.
Do you want to donate something, Carolyn?
No, I
The next piece is the special ed supplement, so you'll, I think that by looking at the summary page, it gives you numbers enough that, I mean, if you want to drill down, we can. But the tuition, in looking at pages 1 through 4, that's your tuition out, right. Next one. There. Okay, so you see your tuition out, your tuition in, and your total served on whatever level we are. Level 1 is the least needy, level 2 is mid, and level 3 is high need. So you can see where we stand on all 3 of those areas. We have a lot more people tuitioning out. Typically, you get a lot of level 1 tuition out in an open enrollment situation. So if they want to go somewhere else, they're going to go somewhere else, and it's not going to be a big issue for a receiving district. If to the level 3s, a lot of times those would be a tuition out versus meaning somebody else can't serve it, or we can't serve certain disabilities or needs of that student. Then if you go to pages 5 through 7 are your receipts, and it shows, we had $5.3 million worth of receipts of just from how they counted the levels, but then keep going up, right, backwards to that same summary page. Part B funds, we have Part B funds, which are federal funds, $157,000, and Medicaid of $164,000. Last year, $164,000 for us was about $300,000. So because we didn't serve those kids, we didn't receive that money. We did pay our staff to, and they didn't have to serve them. They were paid due to COVID. So, transportation cost was just an informational page. You can see that, but then the bottom line is our special ed balance. So you'll see that overall we're at negative $819,000. Last year we were at 659, I think, thousand. So
I will say, districts of similar size, it's not at all uncommon to hear $1 million, $1.5 million. And that's something that, at a recent conference discussion I had, we we're hearing numbers much higher than ours. We do watch that special ed deficit. That's real money we've spent, and we can't always recoup all of it the following year. Sometimes there's a kind of a mistaken idea that special education expenditures aren't really real money, you know. So we do try to watch it, but we have to offer a good continuum of services, and we have to be adequately staffed. And there are students we serve that what it takes to meet their needs just far exceeds the funding we get. And at the federal level, you know, they're supposed to fund up to 40% of that cost. They've never hit over 17%. So it's one of those sneaky unfunded mandates that's there every year. So I don't know, there's has to be very, very few districts in the state that aren't running a deficit. And deficits are growing in many places.
So would the number be back down towards where it was last year if we hadn't have paid?
We
Probably.
don't, I mean.
Do you know
It's hard to
what
say. We
percentage
would have, John identified one factor, for example. We brought in less money with the Medicaid billing because they weren't here, you know, so there's a couple $100,000. If you know, take 200,000 off that, we're
back to
right at what we were the year before, you know, so.
Rob, I think each year, we're serving more and more special ed our clients too.
So,
Right.
and again, the funding comes the previous, it's kind of like everything else. The funding is calculated off last year's number. So this year's funding came from fall of 2019.
Right, and we did have over 50 new special ed students this last year, I believe, you know, to Ken's point, so.
last year, or this year? You mean?
Going into last year.
I think the last couple of years, it's been in that range.
Yeah.
So I know we can pull that if we. Yeah.
Okay.
Where we are right now, it's about 44.
Any questions on any of that? So then, okay, remember the 819,000 that you see, and remember I told you that we could cash reserve up to 1.44? This would be 800,000 of that 1.44 that we could cash reserve. So.
Takes it back down to
Like, say
6.
that to serve the needs of a student costs 20,000, you get 10,000 from the state, or, you know, from whoever. If they go to a different district, does that district pick up that deficit? You know what I mean? Like, if, like, I saw like 2 highly weighted people went to Johnston. It's like, did Johnston kind of
Well, there's a
take
weighted
away some
count.
of our deficit because those people, we don't get the, you know, I
There's a
assume it's.
weighted count date, there's a count date for special ed, just like there is
Yeah.
for our count. So some of it is a timing thing. And I know I'd give an example years ago in another district, we had a very high needs student come from out of state, came after the weighted count date. We incurred tremendous expenditures serving that student, and they left at the end of the year. And you know, we never recuperated. That was just the cost of serving
So
that
the
student.
school district serving the student kind of has that deficit if there is one associated with that student?
If it's open enrolled in or out, or tuition in
Right.
and out, they
Right.
bill us. So
Yeah.
if they go to Johnson, they bill us,
Oh.
we pay them.
Yeah,
So
Okay.
it is actual cost versus this is
Okay.
what we received for them. So it's,
yeah.
special ed is actual costs.
So, yeah, it's, they're counted as a resident student, it'd be on the certified count, the weighted count, but then,
So we get their deficit, so to speak?
yeah,
Okay.
yeah.
Any other questions on special ed? We'll move to transportation. On to the next summary page. This is a very short and sweet one, but it does show that we've increased, so mileage, it shows how we use our vehicles and what they're used for. The student count on page 2 talks about the eligible students for transportation. Well, the one thing that obviously was really different was we only transferred 124 days instead of 180. So, keep going.
It'll be a summary page, you want to stop at,
Next one, there.
there you go.
Okay, so then, the page 4, let's see, page 3 is your expense by category, all the funding pieces. But then the final page is the summary that shows, you know, our cost per mile was $7.48 per mile. to drive a bus. Last year it was $506. So because we paid our drivers and we paid everybody, we had the expense, but we didn't have the miles to spread that out. Also, per student, just it's nice to know, per student it's $711. Last year it was 500 and I think just at around 500 per student to transport.
So would that also in a positive way maybe get reflected in the fact that we postpone the purchase of a bus by half a year? You know how we have kind of a rotation that the
Right.
miles wouldn't be on
Right.
it? So
And we aren't buying any buses this year.
yeah, but theoretically, it's like we have half a year of not using a bus.
Possibly, yeah.
So the mileage should be half a year.
And our buses are used well. I mean, by the time they're done, it's 15 years, you know, so. We just, you know, we've seatbelted them all, so all of them are in seatbelts. So that was a cost that we planned on doing this year to offset, but then when the prices went up, we did it all last year, and they had time to do it, and our guys did it, just so. Any questions? It's the most exciting part of the night, right? Come on.
Sure, Josh.
Welcome to John's world.
Yeah.
So we have a action,
On all three of them.
all three.
Yeah.
We can put it into one. So we could put that into one under letter B, 1, 2, and 3 for annual financial reports, if anybody wants to make a motion.
I move approval of the 2019-20 annual financial reports.
Motion made by Carolyn. Seconded by Ben. Any further discussion by the board? All those in favor say aye.
Aye.
Any opposed? Motion carries 7-0. 2019-2020 special education
Yep, deficit.
deficit.
So this is where we ask for allowable growth and supplemental aid of the $819,000 that was previously discussed. 819,583.33.
And just to reiterate what we say every year, we're asking right now for permission to go and seek that spending authority from the School Budget Review Committee, which you always want to maximize your spending authority, just so you have the ability to, to pay your bills. You don't want to exceed your spending authority. And then the next decision will be at budget time for next year, how much of that amount you want to cash reserve levy. So you're getting the authority now, you'll get the money behind the authority when you levy later in the spring.
I move that the board authorize the district to request $819,583.33 in allowable growth and supplemental aid.
Motion made by Ken, seconded by Carolyn. Any further discussion by the board? All those in favor say aye.
Aye.
Any opposed? Motion carries 7-0.
So same song, second verse on limited English proficient. That's money though. It's $111,343.17. But one of the things that in that report, if you notice, you can see the different languages that we support, and there were 14, not including English. So
Well, I move approval to authorize the requested amount of $111,343.17 for excess limited English proficient cost.
Motion made by Carolyn.
Is that school year right?
Why does it say 19 to 20?
because it's last year. Is it on?
We have to approve it from last year?
Because we just finished it, so
Oh.
we're showing
Oh.
the
Yeah,
expense
this is,
from last
we're
year.
taking a look back at.
Yep, okay.
Yeah, last year's
Okay.
expenditures.
Okay.
Motion made by Carolyn. Seconded
Second
by
by
Ken.
Ken.
Any further discussion by the board? All those in favor say aye.
Aye.
Any opposed? Motion carries 7-0. And next is the board facilities committee meeting report.
Go ahead.
86.
Anyone? Before now.
No,
Well, we just, John and Bernie basically put a list together of the areas that are just in need, kind of across,
It's not a comprehensive list.
right, yeah. And so, we talked about, you know, some of the issues that class sizes and all that stuff that have been other reports, and how upcoming facilities can help with it or not help with that, you know, with auditorium seating, you know, do we need to start bringing in some people just to give us some blueprints of perhaps a new entrance kind of by the north area that would take care of a little bit of a cleanup in the auditorium and the gym. We talked about maybe a new entrance as far as like the media center and up front. So really a really good topic again to add to our work session and see, you know, what the board thinks of different places and if a bond issue is needed or looked at or stuff like that.
So,
Yeah, I think it's time that we get some prices to some of this stuff, especially for the bigger things
that's what we,
that we find in architectural firm. You know, those are things we do, we pay for out of certain funds that we have. And if then we want to move forward, we can, but until we know what the costs are and the problems, we can't really do anything. So
And
I
we
think
talked
that's
about
the next
having a
step.
couple, you know, 2 or 3 maybe come in and give us some ideas, architecture.
Yeah, I mean,
We have several we've worked with in recent history, different projects that I'm sure would love to come in and make presentations.
Right.
That's definitely something we can arrange.
next is the facilities project update. Anything new? All is quiet.
Communication, you know when they're gonna be here, right? Communication innovators, that one, security cameras.
They don't. The contract signed tonight, so
Yeah.
soon.
They're starting the process.
They're not ordering the parts until they get
Yeah. we got-
Signed contract.
I got it, so. Monitor and reading, the contractors are now on site to remedy the issues that we've had in the auditorium, which then pushes the the fall play in the gym. Because they need to practice and they're training, so they are all in the gym.
any idea how long it's going to take to?
They're on site right now, I don't believe it'll take very long, but I think within a week or two, they would be
Oh,
done.
okay.
Yeah.
And when's the fall play?
Fall play is the 1st of November. Problem is, they had to move all the sets, they've had to move everything and practice, you know, so that was the discussion of the fall play advisors. Questions?
Anything? Okay. Next is the board policy committee meeting report.
Yep, you have there in the minutes the list of policies that were reviewed. I don't know if Ken or Ben want to make any comments on that, and then in addition to that, we talked about the things that you acted on earlier with return to learn.
Yeah, nothing really significant change-wise. Under the superintendent and administrator civic activities, I'd asked that we just clean it up, and not surprisingly, but very impressively, Art summed it up in a really nice sentence, so that was about the only change to that, and nothing substantial.
This would be the first reading.
Yeah, we did talk about the fact too that there's nothing here that there is a need to get into policy or rush, so I think the feeling committee was do a first reading tonight, and then there's time for a second reading.
Yep.
If there's no questions, I will move first reading on the policies numbers listed in the Board Policy Committee report.
Motion made by Ken. Thanks, Ken. Seconded by Carolyn. Any further discussion by the board on these? All right, all those in favor say aye.
Aye.
Any opposed? Motion carries 7-0.
We did talk about one other thing in the meeting. I had circulated to all of you to see what people think of the public comment situation in the city things. And only 2 or 3 items from that did the group think should come forward, and they can be incorporated in another policy. There was a feeling of the committee that we have a time limit on each presentation, probably 5 minutes. That everybody, that the form we're using for them to sign in is fine, doesn't need to be a form like this. But it's extremely important that everybody start their presentation with their name and address. Because I just pointed out there's many times I've been here and I have no idea who's talking, in that regard. So it's basically only about the 3 things from here that will get incorporated in another policy as we figure out how to do it. So thanks everybody for the comments they sent to me and for the group that we talked about.
Right.
Okay, so just, because
Please.
so tell me that the address is more important than maybe how they're involved in our district?
I don't think I can give you, just,
I'm just
the reason for an address is to make sure they're in your
our district.
thing. If somebody says 13th Street in Des Moines, we say that's kind of not for you.
Okay.
There's no reason why not. Give us your name and address, and if you want to tell us somehow you're involved with the district fund, something like that would be great.
What do you mean, Sue? What do you mean by that?
Well, I mean, like if someone comes to talk, are they a retired teacher? Are they,
Oh,
do their
Well,
kids go
today's
to
a great
Irving?
example.
Do their kids go, is she a PTO
Yeah, that was perfect to know.
Yeah,
Name, address, and
she did a
that.
good job of telling us.
but not a lot of people
Right.
do that. And then maybe we don't take in consideration their view if we don't realize they've been PTO president and have had to deal with some issues too. So I like the form, I was just,
The objection to the form was that's electronic form. Pointed out, I think would probably are a really good thing. That would be, if we accepted that form and everything, it's on record here forever, digitally. And we don't really need that, for privacy and stuff.
Next is the board calendar. We do have our next workshop on next Monday at 5:30.
Right, we'll plan to start work at 5:30. If you do want to get here a few minutes early, food service is providing a little sack lunch. It's usually quite tasty, and it just depends how much you want to talk with your mouth full. So if you want a few minutes to eat before you dig into the hard work, you can get here a few minutes before 5:30 if you want. But we usually kind of time that roughly 5:30 to 8. It seems like we get. And there's a lot to talk about, but that's up to the board, to see what your staying power is. But if past work sessions are a guide, it's usually roughly 5:30 till 8.
I forgot to mention this during the communications and stuff. I was just gonna let everyone know, you guys all had, well, not everyone, you had conferences as well last week, and they went really well. The teachers did an incredible job, and of course, there's student-led conferences for our district, so the students lead those conferences, and the teachers are really good, at our level, 8th grade, at asking a leading question to let the student kind of get into that conference and stuff, so they did a really good job. I know also I've heard from the community that maybe having Zoom conferences in the future may be a nice way, so I don't know if those numbers were up at all, but it was convenient, and if you're not able to make it over, I heard from different people in the community like, oh, this was great, I actually was able to get.
We have a form for the admin meeting this week to capture all the
Cool.
positives and other things that might be tweaked
Yeah.
and looking at the future,
Yeah.
just because of the convenience and
Yeah.
drive time in the building.
Yeah,
There
yeah.
are different things too.
Well,
Yeah, middle school teachers did a really good job.
and not only that, but it allows, we were in different areas, right? So if there is a divorced family, all of them can be in on a Zoom call.
Right.
And so I was at work and was able to get on, so those parents that normally couldn't attend because of work restrictions, maybe it gives them the opportunity to do that. So
Yeah.
we got the same feedback, as in, I hope this stays after.
Yeah, I've heard nothing bad and I heard
Yeah.
multiple good things,
Yeah.
exactly as you're saying.
I think we had 5, and we started at 3:50 and we're done by 4:30.
The only bad was my fault. I forgot to print the schedule.
Well,
So it was panic time at that time, like, who are we supposed to be talking to? And all eyes went to me, and I was like, oh, I thought you did that. I thought you did that. No, it was my fault, so.
I actually want to give a compliment to people and things I haven't been at. I am literally amazed that we've made it this far in the year, that our sports teams have been able to compete, that our marching band has done well. That had to take extra effort from all those coaches and whatever they are, so kudos to them for putting out the effort to make sure these kids can do it. It's good.
And the cooperation of the kids, but.
Yeah, whatever it is, it's
you're
just,
right.
it's phenomenal.
There's,
I never thought it had happened.
Yeah,
And I don't see any wood to knock on, but I think it's safe to do that.
It's progressed.
Are we on other?
well, yeah, Sue wasn't here for board reports, so let's
Sorry, yeah,
let's
go
circle
ahead.
back, because I know she had something she wanted to share, so.
Oh,
Thank you.
sorry, go ahead.
No, that's okay. So I don't know if you guys know, and I don't know if our community knows that we have really been working hard on our wellness website page here for the district. And on that page, I attended a conference last week and about mental health and all the things going on. But there's an organization that's called We Are Within Reach. And their website's wearewithinreach.net, and it's an entire organization just set for the prevention of suicide. And it has Iowa resources, Iowa phone, it's a whole comprehensive. So that entire link is on that website. So if people are talking like, what are we doing for mental health of our students? Have them dial into that, because it has all the counselors and what schools they're with, the therapist and what schools they're with, all their contact information. It has parent information. It has this link. And then just today, Iowa Department of Public Health put out a very nice info in combination with SAMHSA. And SAMHSA is the Substance Abuse and Mental Health Association. And they did a very nice infographic, one page for parents and students on the behavioral effects of social distancing and like what are the red flags, if people are, because it is a huge issue right now.
What was the website?
It's wearewithinreach.net. So get on there and look at it. They're fabulous resources. So if you hear talk out and about, tell them that we really have, there's crisis numbers on there.
Is that on our website?
It's on the
It's
district
on our school
website.
website?
Yep, it's all under the wellness tab, social behavioral, it's all under the wellness tab. But I don't think a lot of parents know about that tab. I don't think they know that part on our website.
I say everybody listening, hopefully.
Yeah, and Ms. Ellis over at the middle school has done a fabulous job of uploading all this information, putting it on there and making it easy and accessible. So our counselors are referring an all-time high right now. I've talked to the majority of them, and they are referring an all-time high. We all know that this has presented a whole different issue with mental health. So what we're seeing in our line of work at Helping Hand is our numbers are skyrocketing. They're tripling than what they were a year ago as far as those coming in. And so I think we're going to just see more of it. So we will continue to upload more and more resources on there, but it is very relevant information, and it gives you a follow-up plan and exactly who to communicate with. So make sure that we're getting that out to your public. So if you have Facebook pages that you just want to shoot that stuff out to, there's a lot of good stuff.
You're within reach.net.
Net.
Okay.
Yeah, so it's SAMHSA does a great job. They do a ton of stuff on prevention. And that's really where we have to be. We can't be reactive. We have got to be preventative. So
Is that what you're gonna do?
Yeah.
You can share it.
And then that infographic, it's just a one page from the Iowa Department of Public Health. It's basically social distancing and behavioral health. And so I think that's that's at the same place. That's on the same site.
That's on the
Yeah.
same- oh, it is.
Yep, they should have both been, Ms. Ellis told me that she uploaded that one, I think, today.
Oh, okay.
So
Great.
yeah, we're moving
Great,
along.
thank you, Sue. That's great.
If you guys have any other agenda, or not agenda items, but like discussion items for next week, just feel free to shoot them to me and I can get them.
Yeah, I
Did
think
you write down what Sue listed tonight?
The SiAC. I
SiAC
think
and,
Yeah, she texted me on
What was the other one?
facilities.
Facilities.
Yeah, and I think Giada's been trying to keep a little list too, and she'll send like a tentative agenda to you, Rob, for your
Okay.
thoughts, and
Okay.
we'll get back and forth, refine that a little bit,
Okay.
so.
So tomorrow's HR, everybody good for their meetings?
Yeah, I may need to get out to get kids to school. Before we roll out.
And then the next agenda,
I gotta have school, kids at school at 7:30 and 7:45, so.
registered officer packet meeting.
Yeah, I have not talked to him yet. And I have to figure out how to run the discipline report, so. But,
Share
yeah,
with
if he's
them
gonna be
a bit
here,
about
we
what he's
could,
doing.
yeah, absolutely.
Mr. President, I move to adjourn.
Well, I got
Motion
one
made by
thing.
Ken
I
to
got one
adjourn.
thing.
Oh, Carolyn, go ahead.
Oh,
At the next meeting, the regular meeting, I'd like to have kind of an update as to what we're seeing, like with reaching out to kids that we feel like are maybe not engaged
Online.
online. Yeah. I mean, we've talked about it, but I just think it's something I kind of want to know more of it, less of it, similar. Are we successful with engaging them?
Where's that at?
Yeah. Maybe it's part of the return to learn, I don't know.
Yep, yeah, that'd be a good place for it.
Okay.
I made my
Motion made by Ken,
I'll second.
seconded by Carolyn. Everybody's in favor?
Aye.
Yes.
I am sharing, if you want to
Closed.
share, I am
Hey,
sharing
Ben, I have a
that,
question for you before you leave.
our wellness page.
Are we
like
off,
right
right?
now.
Okay.
Okay.
You guys can